with this baby's ear, we have a Stahl's deformity that involves the absence of the superior limb of the triangular fossa, which is a continuation of the antihelical fold. And that can be shown how that's created by putting this cotton applicator behind the ear and folding it back. And that creates the superior limb of the triangular fossa. Now we do need to correct this, to fold this helical rim out and to obliterate this little triangle, this transverse cruise. So that will be done with our retractor system. And then the other thing you'll notice is a conchal cruise that's transversing the mid portion of the concha, and we'd like to flatten that with our conchal former by pressure down. So those are the objectives of this treatment. Now the conchal cruise is a very common deformity that's in association with these other problems, but it can cause prominence of the ear, and so that's the reason that we want to eliminate that. Our first step after is actually shaving the hair so that we create enough of an adhesive footprint for the system to attach. So now we've shaved the hair to create an adhesive footprint for the attachment of the device. And then we're going to prep the skin with alcohol wipes to remove any skin oil. And the reason for that is purely to give as good of an adhesive interface as we can. Now I'm going to look at the sizing and application of the posterior cradle. To put the posterior cradle on, it's so simple. You just lift the pin of the outer appendage of the ear and let it slide through the opening of the posterior cradle. But then you look at what I would call the little bit of room between where the earlobe attaches right here and the upper part of the ear up here. And you can see this can be moved up and down a bit. So there's no impingement on the attachment of the ear. And then the second thing you look for is, can we roll this back and not have it be pinched? And you can see that also is accomplished very readily. So this is a perfect size, and that's how we would know that we didn't need to go to a larger EarWell device. Now the other thing in positioning is we want to have the posterior conformer, which I'm pointing to right here on the EarWell, sitting, we want it sitting just a little bit away from the back portion of the retroauricular sulcus behind the ear, and we want it so that when this is pushed back is an exact continuation of the antihelix. So that's pretty good positioning right there. Now the next step is, once we have our positioning, is just to hold down. I like to push down on the back of the EarWell device and then remove the adhesive strip and then set this down. Now then we'll reverse that and hold down on the front and pull the posterior adhesive liner off. And then press it down. And that attaches the posterior shelf. Now then we'll remove the inner liners, and there are two of them. And this now exposes adhesive on the inner aspect of the device that will serve to hold the ear and its components in position. Now the next component is the retractor. And the retractor is this special device that actually locks around the helical rim. And its front part, it is adjustable, so you can make the curve what you want it to be. But this front edge here actually shapes the scapha, and that's what will obliterate the transverse cruise. And then this area here will allow the helical rim to assume its natural shape. Now, this is now locked over the helical rim, and we don't want this to get so far forward as to rest against this where the posterior conformer is coming across, so I'm making sure of that. And we just set it down, and now we've got it in the right position. The final inner component is the conchal former, which is used to obliterate this conchal cruise right here. And it sits in the cavity just like that. It's very soft, and we'll apply a direct pressure on that when we use the lid, which is the final attachment of the EarWell system. So now the anterior shell has been attached. We just inserted the little tabs into the posterior shell, and it's pushing down on the conchal former and holding the retractor in precise position.